Put your hand over one eye right now. Look at something across the room. Now switch. Cover the other eye. Did things look noticeably different between the two eyes? Did one side seem dimmer or slightly blurrier around the edges? Or did colors look slightly different from one eye to the other? Most people have never done this simple check. Most people have never thought to do it. And the reason we are starting today's video with it is this. Several of the most important changes happening inside the eyes of seniors over 60 show up in exactly that kind of simple comparison. Before any pain, before any dramatic vision loss, before any appointment with an eye specialist, they are happening quietly, slowly, in eyes that may seem to be working fine. Today we are going to tell you what those changes are, why they happen, which ones are a completely normal part of getting older, and which ones are warning signs that need an eye appointment this week, not next year. Stay until the end. Because the last condition we discuss is the one that concerns ophthalmologists most. Not because it is the most dramatic, but because by the time most people notice it enough to seek help, a significant and irreversible amount of damage has already been done. Welcome back. Today we are talking about your eyes, specifically what is happening inside them after 60, why your vision is changing, and how to tell the difference between changes that are simply part of aging and changes that are telling you something important. Let us start with what changes normally, then we will get to what does not. The first normal change is losing the ability to focus up close. If you are over 60, you almost certainly already know this one. You hold your phone further away than you used to. You need reading glasses now when you never did before. Small print requires more light and more effort than it once did. This happens because of a change in the lens inside the eye. The lens of the eye sits just behind the pupil. Its job is to change shape, to thicken or flatten, to focus your vision at different distances. Close objects require a thicker lens. Distant objects require a flatter one. When you are young, the lens is soft and flexible. It changes shape rapidly and effortlessly. But over time, the proteins that make up the lens gradually stiffen. The lens becomes less flexible, less able to thicken when you look at something close. And the result is that close vision becomes increasingly difficult. This is called presbyopia. It is entirely normal. It begins in the early 40s for most people and progresses steadily. Reading glasses correct it. So do progressive lenses. So do contact lenses. It does not damage the eye. It does not affect your distance vision. And it does not mean anything serious is happening inside the eye. It simply means the lens has become less flexible with age, the same way most things become less flexible with age. The second normal change is needing more light. Have you noticed that you need brighter light to read comfortably than you used to? That dim restaurants are harder to navigate? That you need the lamp on earlier in the evening? This is also normal. Several things happen with age that reduce the amount of light reaching the back of the eye. The pupil, the black circle at the center of the eye that controls how much light enters, becomes slightly smaller with age and responds more slowly to changes in light levels. Less light gets in, and the adaptation to darkness takes longer. The lens of the eye also becomes slightly yellower and less transparent over time. This filters out some light before it reaches the retina. And the retinal cells that process light, particularly the rod cells responsible for low light vision, become less numerous and less efficient with age. The result is that older eyes genuinely need more light to see as clearly as younger eyes. This is not a disease. It is a normal aging change. Practical adjustments, better lighting at home, brighter reading lamps, avoiding driving at night when possible, taking more time to adapt when moving from bright to dark environments. These are not signs of failure. They are sensible responses to a real and normal change in how the eyes work. The third normal change is increased glare sensitivity. Driving at night with oncoming headlights, walking from a dark cinema into bright daylight, looking at a bright window in an otherwise dim room. Glare that younger eyes handle easily becomes genuinely uncomfortable and sometimes disabling for older eyes. This happens for similar reasons to the light sensitivity change. The aging lens scatters light more than a younger lens does. Instead of light arriving cleanly focused on the retina, some of it scatters across the eye, creating a veil of diffuse light over the image, which is experienced as glare. Anti-reflective coatings on glasses significantly reduce this. Polarized lenses for outdoor use help, and being aware that glare sensitivity is a real and normal part of aging, rather than something to push through, matters for safety, particularly when driving. The fourth normal change is seeing floaters. Most people who develop floaters, those small, transparent, or gray shapes that drift across your vision, particularly when you look at a plain, bright surface, develop them somewhere between their 40s and 70s. Floaters are caused by small clumps of the vitreous, the gel that fills the inside of the eye, as it gradually shrinks and becomes more liquid with age. These clumps cast tiny shadows on the retina and appear as floaters. In most cases, floaters are entirely harmless, annoying, distracting, but harmless. However, and this is important, a sudden significant increase in floaters, particularly if accompanied by flashes of light in your vision, is not normal aging and is not harmless. A sudden shower of new floaters, especially with flashing lights, can indicate that the vitreous is pulling away from the retina and in some cases tearing or detaching the retina. Retinal detachment is a medical emergency that can cause permanent vision loss if not treated urgently. If you have had occasional floaters for years, probably fine. If you suddenly see many more floaters than usual or see flashes of light, call an eye doctor the same day. Now we get to the conditions that are not normal aging. These are the ones that need your attention. The first is cataracts. A cataract is a clouding of the lens of the eye, the same lens that normally helps focus your vision. As proteins in the lens clump and cloud over time, usually developing gradually over years, vision becomes increasingly blurry, hazy, and muted. Colors look less vivid. Glare becomes worse. Night vision deteriorates significantly, and eventually vision becomes clouded enough to affect daily life. Cataracts are extremely common. By age 75, approximately half of all adults have cataracts significant enough to affect their vision. The progression is slow enough that many people do not notice until quite significant clouding has developed. The check to do right now. Compare how vivid colors look between your two eyes. A cataract often develops more quickly in one eye than the other. If one eye sees colors as noticeably more muted or yellowish than the other, a cataract may be developing. Cataracts are treated with a straightforward surgical procedure that takes about 15 minutes per eye and is one of the safest and most commonly performed operations in medicine. Most people notice a dramatic improvement in vision the day after surgery. The important message: do not wait until vision becomes severely impaired before seeking assessment. Earlier surgical treatment produces better outcomes, and untreated cataracts significantly increase fall risk, partly because of the visual impairment and partly because they affect depth perception. The second is glaucoma. This is the condition that concerns ophthalmologists most, and the reason is exactly what we mentioned at the beginning. By the time most people notice something wrong with their vision from glaucoma, a significant and permanent amount of damage has already occurred. Glaucoma is a condition in which the optic nerve, the nerve that carries visual information from the eye to the brain, is progressively damaged. In most cases, this is associated with raised pressure inside the eye, but not always. Some people develop glaucoma with normal eye pressure. The critical feature of glaucoma is that it affects peripheral vision first, the edges of your visual field. And because the brain is extraordinarily good at filling in gaps in peripheral vision, compensating for the loss without the person being aware, glaucoma can silently take a large proportion of the peripheral visual field before the person notices any change. By the time central vision is affected, by the time something is obviously and clearly wrong, the optic nerve may have lost a third or even half of its fibers, damage that cannot be reversed. The check: hold both arms out to the sides, wiggle your fingers. Without turning your head, can you clearly see both hands moving at the edges of your vision? If one side is noticeably less clear or absent, see an eye doctor this week. This is a very rough check. It does not replace a proper visual field test, but it gives you a first impression. Glaucoma is detected during a routine eye examination, including a measurement of the eye pressure and an examination of the optic nerve. It is treated with eye drops that lower the pressure. Treatment does not restore lost vision, but it stops or significantly slows further damage. This is why regular eye examinations every 1 to 2 years are not optional for adults over 60. Glaucoma is the silent thief of sight, and the only way to catch it before significant damage occurs is through examination, not symptoms. The third condition is age-related macular degeneration. The macula is the central part of the retina, the area responsible for your sharp central vision, reading, recognizing faces, seeing fine detail. Age-related macular degeneration, AMD, affects the macula. It is the leading cause of severe vision loss in adults over 60 in developed countries. There are 2 forms. The dry form is more common and progresses slowly over years. The macula gradually thins, and its cells deteriorate. Central vision becomes gradually less sharp. A blurred or blind spot may develop in the center of vision. The wet form is less common but more aggressive. Abnormal blood vessels grow beneath the macula and can leak fluid or bleed, damaging the macula rapidly. Vision can deteriorate significantly within days or weeks in wet AMD. The check to do right now. This is called the Amsler grid check. Find a piece of paper and draw a grid of squares, or imagine a window with regular panes. Cover one eye. Look at the center of the grid with the uncovered eye from approximately 30 centimeters away. The lines should appear straight and regular. If any of the lines look wavy, distorted, or if there is a blurry or missing area near the center, see an eye doctor this week. These findings warrant urgent assessment to rule out wet AMD. Do this check for both eyes separately. AMD in its dry form can be slowed by specific nutritional supplements, a combination of vitamins C and E, zinc, lutein, and zeaxanthin, that have been shown in large clinical trials to reduce the progression from intermediate to advanced AMD. These are not regular multivitamins. They are a specific formulation. Ask your eye doctor whether they are appropriate for you. Wet AMD is treated with injections of medicine directly into the eye, which sounds alarming but is performed under local anesthetic and is the most effective treatment available for preserving vision in this condition. Here is the most important message of this entire video. Vision loss from glaucoma and AMD is largely preventable or significantly delayable with early detection and treatment. Vision loss that has already occurred from these conditions is not reversible. The gap between early detection and late detection, in terms of the vision you keep, is enormous. A routine eye examination takes 30 minutes. It is not painful. It is not difficult. And in adults over 60, it should happen every 1 to 2 years regardless of whether you have any symptoms. Not when you notice something, before you notice something. Because by the time you notice something, with glaucoma and AMD specifically, the window for maximum protection may already be partially closed. Book the appointment this week if you have not had one in the past 2 years. Before we finish the simple checks to do right now, cover one eye, look across the room, switch. Do colors look noticeably different between the two eyes? Does one side look dimmer or less vivid? Cataracts. Hold both arms out to the sides and wiggle your fingers. Without turning your head, can you see both clearly at the edges of your vision? Glaucoma check. Look at a grid or regular pattern with each eye separately. Do any lines look wavy, or is there a missing area near the center of what you see? AMD check. If any of these checks produce a finding that concerns you, do not wait for your next scheduled appointment. Call your eye doctor and describe specifically what you noticed. Let them decide how urgently you need to be seen. Today we covered what changes normally in the eyes after 60, presbyopia, needing more light, glare sensitivity, and floaters, and what does not, cataracts, glaucoma, and macular degeneration. 3 conditions that are common, largely preventable in terms of severe vision loss, and detected through regular examination long before symptoms appear. Share this with someone who has not had an eye examination in more than 2 years. The 30 minutes it takes could protect something they can never get back. Subscribe for a new, simple, honest health video every week, made just for you. Take care of those eyes. We will see you next time.